I'd like to speak a bit about how transformational learning is an essential component of advocating for education. I've been involved for many years in education and training across 4 continents, 15 countries, and many different styles, from community-based through the programme of in-service undergraduate and postgraduate, including setting up departments in universities, particularly Makerere University, where I am now, but also in the broader ways in which we can advocate for inclusion of education at different levels. For this short film, I want to focus on transformational education. Now, what do I mean by that? This is Catherine. She was a 9-year-old girl with severe respiratory distress. Actually, she was just days away from dying when I met her, when we dealt with some very painful and difficult issues for her, and when she gave me permission to use this picture and her words to teach others. Here is a gentleman I met in India, who again gave me his permission. Now, what was common about these two? Catherine spoke very movingly that she wanted to hear what was happening to her. She didn't want people to ignore her. She thought she might be dying and nobody would speak to her. And the distress of that was huge. And she wanted to tell us that. And we were able to help her in that journey of acknowledging what was happening. When I asked her, could we use her words? She said, you can use a picture and my words, but I have to choose the picture. Or this gentleman who thought that his life was over when he had been diagnosed with cancer, but actually this is a picture of him now with his granddaughter that he never expected to meet because of the palliative care team's advocacy in the community in rural India. Palliative care is at its heart something which talks about mortality and our humanity. It's a compassionate response to that. And if we can connect with those that we're advocating with, those that we're teaching, that will probably make a bigger difference in all of the elegance of our arguments. So you've already learned about how to advocate. You know the principles of that. I want to talk about why palliative care is unique in giving us an opportunity to do that through education. Because palliative care at its heart is transformational. Practices, lives, systems, societies, and ourselves included in that. And so as we go and we tell these stories, this is a woman who spoke to the national conference, including many educators, and we captured what she had to say. You gave me hope, you gave me pain control and love. Make sure everyone has this care. This is Ahmed in Gaza, who is teaching medical students. Now, we use this in our actual teaching, don't we? We tell the stories, but we need to tell those stories also to those involved in designing educational programs, in responsible for education. We need to collect the evidence for that. This was an integrated program for nurses. And this surgical nurse was talking about how it changed me. The bosses were saying, this has become ours, not yours. Then they become some of your biggest advocates. Here's Gaza students again. Look at the values they're talking about: love and compassion and hope and mercy and justice and humanity, in a situation where perhaps some of these values are not seen in that global conflict scenario. And here again, a very powerful statement by a postgraduate in internal medicine. The palliative care training has made an impact. I see the patient as a person and not a disease. I don't avoid difficult conversations. I don't order unnecessary investigations. I see them as part of a family. I do holistic care. And then this person turned to me and said, and it feels much more satisfying. Now, why am I emphasizing this? Number one, this is an opportunity we have to really operate at a values base. And we know that's what changes minds and hearts. Yeah. Secondly, these people we train go on to be our best advocates. Perhaps one of those people we look after is related to somebody in an influential position, or perhaps they themselves will become one of those people. Let's go for the long game, and they can make a difference because they themselves were changed. Here's another example where we worked in the middle of the COVID epidemic with amazing colleagues from India to make a difference in COVID-19 education. Then we use that to advocate with the government to include this into routine practice. And you can see how we did that, taking it more broadly and including the words of our youngsters. And don't forget to train the next generation of leaders. I was involved in leadership as a mentor with a program from San Diego, a leadership program from there. And also we've been involved in several cohorts of leadership training within an African setting, Ugandan setting. And those leaders are now our best advocates. And engage the community. This is refugee communities that we've been engaging with, faith-based communities. They themselves will then advocate for better education. And lastly, make sure you're willing to be changed yourself and practice what it is that you want to show in others. Thank you for listening to my tips on transformational education, and I wish you well. Hello there, it's Dr. Mhoira. You were calling me? Hello, it's Dr. Mhoira. You were calling me? Lovely. So you just, lovely. You stand at that grey gate and I'll be with you in just a moment. Okay. The grey gate. You see the grey gate just beside RDC's office? Okay, I'll just be waiting.